Patient is a 51-year-old male who presented to the emergency department yesterday for a referral from his primary care physician. Routine labs at the doctor's office revealed that he had low platelets. In the last month, the patient has had 2 ER visits, one in Miami and one in New York City. Uh, Apparently, the one in Miami occurred first several weeks ago, where he had lower extremity edema and cellulitis. He says that he drives long hours at a time, transporting migrants from ports, detention centers to other detention centers throughout the United States. Um, his second visit, his first visit to Miami was in May, and at that point he was prescribed amoxicillin and Bactrim. He says he started experiencing headaches, fatigue, palpitations on exertion, um, shortness of breath, as well as dizziness upon standing. He does say he had a fever of about 102 for 3 days, as well as chills. Um, he says the medications that they prescribed him in Miami is what caused that. But he does say that after the 7 day course of antibiotics, he started to feel better, but shortly thereafter, a couple of days, the symptoms came back. Um, the right lower extremity swelling began after a trip to New York City. He noted that the symptoms at that time were different from the cellulitis diagnosed previously in Miami's. And over the course of the last 2 weeks, his symptoms have worsened in both lower extremities, which he has been taking 600 milligrams of ibuprofen around the clock every 6 hours for the swelling and the pain. Um, Review of systems. Patient is a full code. Constitutional, no sweats, no fever or chills. Positive for fatigue and weakness. Eye, no recent visual problems. ENMT, no ear pain, no nasal congestion, sore throat. Respiratory, no cough, no shortness of breath on exertion at this point. Cardiovascular, no chest pain, syncope, palpitations, positive on exertion. GI, no nausea, vomiting, or diarrhea. Denies bloody emesis, bloody stools, melena. Genitourinary, no hematuria. Hema and lymph, negative for swollen lymph glands, positive for bruising tendency. Endocrine, negative for excessive thirst and excessive hunger. Musculoskeletal, patient denies back pain, neck pain, joint pain, muscle pain, decreased range of motion. Positive for sciatic pain to the right. Integumentary, no pruritus, abrasions. Positive for petechiae. Neurologic, he is alert and oriented, ×3. Psychiatric, no anxiety, no depression. A patient problem list and past medical history. He denies any medical history and denies taking any medications at home. He denies alcohol use as well as tobacco use. He is employed, high school education. He lives with his wife, and at home he is independent. Pertinent lab results. RBCs are low at 1.63, hemoglobin at 5.4, MCV and MCH at 103.1 and 33.1. Platelets are 42. RDW, CV, and SD are 17.4 and 64.9. CO2, 21. AG ratio is 1 and low. And LDH is high at 295. Other than that, there are no other pertinent labs. Diagnostic results, he did have a chest x-ray on admission, and there was no acute cardiopulmonary abnormalities. Vitals and measurements. Tmax is 36.8. Heart rate 115. We have respirations at 17. Blood pressure is 135 over 67. SpO2 is 100% on room air. Height is 186 centimeters, and weight is 122 kilograms. Assessment. The patient generally is alert and oriented. He's well nourished, in no apparent distress. Eye, he is pearl. Eye movements are equal. Pale conjunctiva. HEENT, he is normocephalic, normal hearing, moist and pale oral mucosa. No scleral icterus, no sinus tenderness. Neck is supple, non-tender, nor carotid bruits, no JVD, no lymphadenopathy. Lungs are clear to auscultation and percussion. He has no labored respirations. Heart, cardiovascular, he is tachycardic, regular rhythm, no murmurs, gallops or edema at this time. Abdomen, soft. He is obese, non-tender, non-distended, with normal bowel sounds, negative for masses. Bruising is noted on his right lateral lower abdomen. There is a pulsatile mass with an audible pulse in the fold of his belly. Patient states it's secondary to belt irritation. Musculoskeletal, normal range of motion and strength, no tenderness. 1+ bilateral extremity edema. Skin is warm, dry, and pale. Scarring is noted to the right lateral neck. Raised lesions noted on his upper back. Bruising noted on upper thighs. Petechiae noted all over, worse in extremities, except for his face. Neurologic, he is awake, alert, and oriented ×3. Cranial nerves 2 to 12 intact. Genitourinary, there is no hematuria. Psychiatric, he is cooperative and calm, appropriate mood and affect. So the plan for this gentleman, plan and assessment and plan. Number one is symptomatic anemia. The plan for this is to transfuse at least 2 units of PRBCs as per the findings on his CBC with differential. Trend his H&H and continue to monitor his symptoms. CBC with diff, CMP, PTT, PTINR daily to monitor changes. We're going to do a peripheral smear collection as well as occult blood in his stool. Number 2, thrombocytopenia. We're going to look for the underlying cause and treat appropriately. Number 3, fatigue, most likely secondary to the CBC abnormalities. Currently, we're trying to get his medical records from Miami and New York City to see what their findings were. We're planning to work him up for anemia versus leukemia versus another blood cell disorder. So we will investigate this further and try to determine what the bleeding source is. But our current goal is to transfuse the patient and assist with his oxygenation if needed. There will be we don't see a reason why the patient should be intubated in the near future. Bilateral lower extremity, number 4, a venous Doppler is ordered. Results are pending. We will start to give LACE-640 BID to see how he responds to that, though he does deny shortness of breath. Number 5, pain control. We're going to give him acetaminophen 650 PO, Q4RN, PRN, as well as acetamin hydrocodone 325-5, Q6 PRN. For pain, we'll give him Colace 100 milligrams PO, BID as needed for constipation, and Zofran should he experience nausea. Thank you.